Okay, everyone. So today is Tuesday, January 14th, 2014. My name is Rhonda Butefeld, and I am with the State Unit on Aging. I am a program analyst, and in particular, I like to focus on data. And what we're going to talk today about is the nutrition data that is represented in Oregon Access and what comes out and is created into our annual report. Now, as I said a little earlier, but before recording this session, Kim LaCroix was expected to be here, but she's not well today, and so she will not be here. Kim actually is the individual who she works actually with the State Unit on Aging, and she also works with Public Health, and she administers our Older American Act Nutrition Program. And so she is a marvelous resource for you. I imagine you have each met her, but if not, I want to encourage you to reach out, introduce yourself, and be sure to ask her for any assistance that you need or ideas. At the end of this presentation, I will have her contact information available for you also. So we're going to go ahead and proceed. So today's objective is we're going to, I'm really hoping here that we're going to improve our data reporting to accurately capture our nutritional risk and maximize the program effectiveness and obviously our funding opportunities. And utmost importance to that will be in understanding the federal reporting requirements for all of our federal programs, but in particular today, the Older American Act Nutrition Program. So we're going to talk about the importance of reporting this nutrition data. We'll also review our current numbers. We'll talk about how to report and to pull some data, and then tips on improving our reporting. Welcome, Marcy. I see that you've just joined us. I have everyone muted. However, actually, I don't have everyone muted. I've asked that you mute yourself. And so if you'd go ahead and do that, and then if you have any questions, unmute and ask those. Okay. So it looks as if part of this text is obstructed, but what it actually says is the Older American Act Nutrition Program purpose, and this is from Section 330 of the Older Americans Act. The last act was reauthorized in 2006, and so all references are actually from that act. The goals of the OAA nutrition program are to balance hunger and food insecurity with socialization and the well-being of older adults. And so we do know we want to reduce hunger and food insecurity. We want to promote that socialization of older individuals and obviously promote health and well-being. Adequate nutrition on a daily basis is the key to a person maintaining the adequate health necessary to live at home. It helps improve chronic conditions. Frequent contact with others in that congregate site also, adds that element of being able to monitor the participants' health, their well-being, and their safety. So when we talk about demographics, nutrition programs are always challenged to meet the changing demographics of an aging population. And I know we have participants today who are right on board and have followed the baby boomer generation and are experts at this. And I know that you really understand how the baby boomer generation is basically changing a great deal of the demographics of our nutrition recipients and what they want in a nutrition program. Their life expectancy actually has increased. We're living longer. We're managing our chronic conditions, and we're feeling healthier. So collecting this nutrition data will help us understand the demographics of those clients that your agency is serving, and then also it's going to help not only you, but the state and the nutrition, your nutrition program analysts be able to figure out ways to better meet the needs of these individuals. An example is our increasing population of Latino and Hispanic older adults in Oregon. As we see this, we certainly may want to wish to change our outreach methods, our outreach plan, and obviously our menu offerings. So why report nutrition data? Well, later on, we're going to talk more thoroughly about the specific grant requirements for use of older American Act dollars, but in short, the federal government requires us to collect and report data that demonstrates the usefulness of these federal funds. And collecting the data can help tailor interventions for those that are most in need. We'll be talking about ADLs and IADLs, special diets, this type of thing. And also this data and why we report it is, it adds credibility and it helps us to market and promote our programs. It's really valuable actually in your ability to tell your story to outside funders. And Evelyn Kinsella is one of our participants, and perhaps a little later she might be able to share. She is very effective at promotion, and she could share some of the things that she does at her agency in promoting. Her voice is on the radio frequently. It's just incredible what Food and Friends has, how they have really made themselves known down in the Josephine, Jackson County, and even surrounding areas such as Klamath and Coos and Curry. All right, statistical data. Next, we're going to review some current federal, state, and local data. It's always interesting, at least for me, to look at data. It's incredible what it says. And what I just recently learned, in fact, that researchers, they were actually estimating that food insecure older adults are so functionally impaired that it is as if they were chronologically 14 years old. Food insecurity occurs, and I think this is important to really recognize what food insecurity is. It occurs whenever the availability of nutritionally adequate and safe food, or the ability to acquire such food in socially acceptable ways, is limited or uncertain. So as you look at this slide, you will see actually that 11% of 50 to 59-year-olds in Oregon are actually food insecure. And this is a slide that Kim pulled together, and I believe that the reference to 8th is that we are actually 8th in the nation. Let's see, I'm sorry for that noise. It sounds like I might need to look and see if somebody needs to be muted here because they didn't mute themselves. All right. There we go. Okay, also 5% of Oregon seniors are food insecure. So not just the 50 to 59, but from that age actually of officially 60 through death. So what we are going to look at here actually is a nationwide look, and the other major public health concern that afflicts our nation right now is the ballooning, and there's no pun intended, but that ballooning rise in obesity over the last 20 years. And as you can see here, that in 1990, almost all states had less than 14% of their population suffering from obesity. But by the year 2000, only the state of Colorado had less than 14% obesity. And by the year 2010, every state aren't really doing too well. You'll see that we have a 25 to 29%. So now let's look at this county-wise. And this doesn't surprise me a bit. Look at Deschutes right there. 14.6 to 19.9. That is the recreation mecca of Oregon. Deschutes County is the only county with less than 20% obesity prevalence. Older adults are more likely to be obese than younger adults. And these days, many older persons in need of services are not tiny and frail. They're actually large and frail. The increase in the aging population is colliding with the epidemic of obesity, and failure to address the problem of obesity in older adults may even erode some of the gains made in life expectancy in the last century. Now, if you're done looking at this, I'll go ahead and move forward. Very interesting. So among Oregonians age 55 and over, with some exceptions, frequency of chronic conditions does increase with age. And this pattern here holds true for arthritis, heart disease, stroke, and high blood pressure. As you look at this chart here, you will see that arthritis is more prevalent among older adults and is associated with overweight and obesity. Arthritis, high blood pressure, and high cholesterol actually have the highest prevalence by far. You can see these lines. We have the breakout by age, according to the legend right here. So I hope each of you are familiar with these 10 questions. These are the 10 questions that will help determine an individual's risk, their nutritional risk. And later in the webinar, I'll show you where this data is entered into Oregon Access, and you can see the weight of each question. Our nutrition risk rates go from a 1 to a score of 21. Basically, if you look at these 10 questions, each question would have the value of 2 points, and one question has a 3-point value. I do not know which that is, but I would guess likely question number 10 would carry a 3-point value because you're certainly at nutritional risk if you are not physically able to shop, cook, or feed yourself. There we go. Okay, so what we have here, I'm still compiling our 2013 data for integral analysis, but I do have the data compiled from the last 3 years, and so we're just going to take a look at this. And so you'll see each of these columns is representing a year. We have 2010, 11, and 12. Now, the number in Oregon, the number of unduplicated clients served, that means you're counting that client only once during this 12-month period, and our fiscal year runs from July through June. So in 2010, we served 37,980 congregate meals. In 2011, that actually dropped by 3,548. And then you'll see that it picked up slightly from 2011 to 2012, and so we had an increase of 396. Now, of those congregate patrons, you'll see that in 2010, the number at high nutritional risk was 7,537. In 2011, it was 7,662, so we had an increase. I do not know what the explanation was for a decrease, but we did have a decrease in 2012. It may be that throughout these last several years, we've really focused on the accuracy of reporting, and so it could be that some of the client records in Oregon Access were cleaned up, or perhaps these individuals have been on a health promotion program. I really cannot speculate, and I think that as we come to 2013 and add those figures, it'll be much clearer for us to be able to identify whether in fact it is actually just the integrity of the data that we are reporting, or if perhaps we have a program, some kind of a health promotion, chronic disease prevention program that is assisting in lowering the high-risk individuals. Now, we talked about Congregate. If you look here, you can see these same numbers, and I won't go over them, but the same numbers here you can see for home delivered and also for nutrition counseling. Nutrition counseling is something, the reason we have 0 here is because we did not have any AAAs at all focusing in 2010 or 2011 on nutrition counseling. And the Older Americans Act requires it, and so we have been out, actually Kim LaCroix has been out and assisting the AAAs in developing programs for nutrition education and nutrition counseling. And so you'll see last year in 2012 we were able to report numbers. So 1,763 individuals were provided with nutrition counseling, which is a one-on-one counseling by a certified individual. Okay. So the number of home-delivered meals has increased over the years, while the number of congregate meals has actually decreased. This is possibly indicative of the number of frail older adults staying in their homes, or it could be because of competing gathering places such as McDonald's and other low-cost eateries. So data can leverage funding opportunities. And an example, and hopefully we have a AAA that might be able to share something here, but one example is coordinated care organizations are really focusing on performance outcomes, and nutrition data has a very strong appeal. Better nourished patients mean improved performance outcomes. And so CCOs are focusing interventions on those with this highest need. And nutrition data obviously will help tailor that intervention. I do understand some AAAs are exploring this opportunity. And so at the end of the program, or if there's anyone right now, I love interactive, and unfortunately having to mute everyone, that just destroyed that ability to be interactive. But I'd like to unmute you, and if anyone has anything to share about their AAA working with the CCOs with a focus, I would love to hear from you. So let me just take a second and unmute everyone and give you the opportunity to speak. My unmute button isn't working, so I'm having to individually select you. I'm unmuting most of you. We're almost there. Okay, make this unmute worth my effort. Does anyone have anything they'd like to share? Don't forget you.
Yeah, Rhonda.
Yes, Marvin.
Yes, we're working closely with the CCOs in the Columbia Gorge region and the Meals on Wheels program. Can you tell about what you guys are doing?
We're doing after-patient care. So after surgery, when the client goes home, we will actually be providing nutritious meals for folks 60 and older, but they're willing to pay for folks that are under 60 also. So better nutrition means faster recovery times, and hopefully the doctor will be seeing them less and less hospital stays. So that's what we're doing.
And
that's through the Mid-Columbia Medical Center in the Dalles.
And that is an excellent example. And I'm really pleased to hear, too, that they are willing to pay for meals that are under 60, because obviously then you are you're helping gain that health so that when that individual is 60, they're more apt to go to your congregate meal site than have to rely upon a home-delivered meal.
Absolutely. And it also helps our program as well.
Yeah, and we're actually, the AAA here is also going to start doing that in Hood River with Providence.
All right. Thank you, Marvin. You can go ahead and mute,
We
and
have
we
the
will.
same, there
hello.
is a relationship that's being formed. This is Evelyn, Rogue Valley Council of Governments, and there hasn't been a lot of referral as far as the home-delivered meals, but a lot of referrals, I believe, for options counseling. I feel that the nutrition referrals will come later as the discharge planners get used to the idea that they can use this service. Also, the CCOs here are willing to pay for under 60 at the full Medicaid reimbursement rate.
Okay, so as long as they've been referred by their Medicaid case manager?
No, they'll reimburse under 60 at the rate,
Oh,
the
my.
same rate as the Medicaid rate.
That is marvelous.
So in other words, if someone's under 60 and gets discharged from the hospital and they're not 60, the CCO will match that Medicaid amount. They have nothing to do with Medicaid, it's just that dollar amount.
That is very,
Does that make sense?
yes, and I really applaud your efforts to negotiate that, because I believe that is that a $9 figure now?
Yeah.
$9.64, I think, or $9.68, which is, I mean, that's an excellent idea. And if anybody else isn't doing that, I would encourage you to do the same, to be able to use.
I would just point out that, again, we haven't had a lot of referrals, so I don't know how long that will continue, but at least, you know, the one under 60 that we had, they did reimburse at that rate.
That's very good. Does anyone else have anything else they'd like to share? All right, then I'm going to go ahead and mute you each again, and I do thank you so much for sharing. I really appreciate that. Okay, so we're moving on to a new slide here, which is also talking about funding resource streams. And this is, you report your expenditures annually to me, and so what I'm showing here is for the home-delivered meal, basically federal funds are used for 31% of those. And you are providing a match, and we have also in this leverage would include the client contributions and any other contributions that you have received. Then likewise for our congregate, we have 43% of the congregate meal has been provided with the federal dollars, and 57% of that is your other funds that have been contributed. So in terms of tips for improving reporting, I think it's important that you definitely ensure some confidentiality. I do hear from the AAAs, not frequently, it used to be more frequently, but we've heard a lot of AAAs talk in the past about the inability to extract different information from the client or the recipient, that meal recipient. And I understand that. I'm reserved myself about giving information, but I think that if we can frame that message of gathering the information properly, to help them understand why you're asking these questions, you'll be far more successful. And after this particular webinar, hopefully, you know, if you don't already understand why you want to gather this data, you will have it much more pronounced in your own mind about why you want to ask that this information be gathered. So this is always my favorite part here, the state program report, also known as the SPR. And I'd really like to dive in. But before we dive into collecting and reporting and reviewing this required data, I did forget to mention we're scheduled for 90 minutes. I'd like to continue on until we feel that there's consensus that we should maybe take a break. We're really only intended for another 60 minutes, and I certainly want to cruise through all of this, so I'd like to just push on. But I do encourage you, if you have the need to take a break, feel free to walk away and do that, because we are recording this, and you can watch this later on at your own leisure. So let's go ahead and move right on to the nutrition service data. Why are the client answers to the NAPIS registration important? What does the AAA do with this NAPIS information? And what happens to that information? So the Older Americans Act actually requires that we focus on a target individual. And so I've typed in here, I know it's rather big here, and I will go ahead and read this to you, that our target individual who will receive any Older American Act should be older individuals who have the greatest economic need, with particular attention to low-income older individuals, including low-income minority, older individuals with limited English proficiency, those at risk for institutional placement, and older individuals residing in rural areas. Now, again, you can see this in the Older Americans Act, Section 306, Paragraph A. That should be 1. That should not be A. So it's A1. So how do we prove that we are targeting that population? Well, the data that you're collecting actually is reported in the annual report, the SPR. And so they take a look, and we will look at this in a few minutes here. We're going to look at your client's age, their gender, the zip code is what's identifying if it's rural, their poverty, you're asking if their income is below or above such and such amount, and that is establishing their poverty. Do they live alone? That is when you ask the number in their household. You are gaining that, and also their race and ethnicity. So here again, as many have said, is why is this NAPIS registration so darn important? Well, let's take a closer look and we will soon see. This is from 2013. This is the report I'm still working on. I'm hoping to actually submit it to the federal government this week. But this is the first page of our SPR. And what you'll see here, line 1 right here, is an unduplicated count of individuals who have received registered services. So a registered service is, and you'll see this clearer on our next slide too, but a registered service is basically a service in which an individual is getting one-on-one attention. An example of a registered service is personal care, homemaker services, a home-delivered meal, case management, adult care, congregate meal, those type of things. So you'll see that in Oregon, 52,809 received a registered service. Registered services are required to have client demographics uploaded. Now this second one here is the unduplicated client count of unregistered services. That is 313,928. So the total estimated clients served here in Oregon is 358,503. Now, you might ask, well, what's an unregistered service? An unregistered service is a service in which we report our client count and our unit count, but we do not need to have a name associated with a client because we do not need to report the demographics. So an example of an unregistered would be legal assistance, nutrition education is one, transportation, elder abuse prevention and fraud. There's a plethora of services that you are eligible to expend your dollars on that are unregistered services. Okay, so moving in to the second, what we want to look at is, this is actually, this is called Section 2A. The SPR is divided up into 4 sections. And so what we're looking at right now is Section 2A. And you'll see here that right here we have, in fact, this column is the unduplicated persons served. This is the number of persons served at nutritional risk. And here are our service units. So you can see right now that for congregate meals here, 36,102 individuals have unduplicated. We've only counted them once. They have received a meal. Of those 36, the system is showing that 5,190 are actually at nutritional risk. And it looks like my box is not quite big enough there, but the total number of congregate meals served this last year was 928,300 and either 58 or 68. Now, this is another page of the SPR. Fascinating to look at this, and I've tried to color code this so you can really see this. So this is telling, again, these are the congregate clients. So this is saying of those 36,102 clients, the number reported below poverty was 2,515. Now, look down here to this blue here. Right here, you'll see the number that we don't have any poverty information on. It's missing. It was not entered into Oregon Access, is 21,625. So that's why you have such a low number. It does not mean that everybody else of those 36,000 36,000 are above poverty. It's that we don't know. Now, here is our age breakdown. And you'll see here, by the way, of that 36, we do have a reported age of 23,000, but 11,000 we did not catch what their age are. Here we have our gender and our gender missing. And again, it goes into our ages, the age breakdown. So 85 and over, and that's awesome to know that we have congregate patrons who are 85 and over. You'll see that the vast majority are female. There are less males, and then 63 of the 23,955, we don't know what age they exactly are. So what makes, or I mean, we don't know what their gender is. So it isn't 23,000. It's actually the number of these individuals here between the adding the female and the male. Here you have your rural clients and your rural missing. And again, you have your age breakdown. These reports are available per AAA. And I do send these out. I will send this out. Your office might have already printed it from RAIN, and if not, I have a printed copy which I can PDF and provide to you so that you can see your own statistics. Demographics, in addition to the poverty, do they live alone or not, are our ethnicity and our race. And I couldn't fit everything on, so I stopped here at total minorities because it goes through everything, each of the ethnicities, such as Pacific Islander, American Indian, all of those, Hispanic, white only, that type of thing. Okay, so in talking about the data flow, so where does the data come from and how does it flow through the system into the report? I've identified here that the AAA and the nutrition site aids the client in completion of that NAPIS form. The NAPIS form is basically step one. Once that data is on that NAPIS form, and we'll take a look at one a little bit later, it has to be entered into Oregon Access. And that is where it actually uploads into RAIN. RAIN is actually a web program in which it mines Oregon Access and pulls all of the data, the client, the service, the demographic data that you've input. It pulls it every night at midnight and uploads it there into RAIN. And then you have that ability to go into RAIN, and if you do not have a RAIN login, you've never been there before, talk to someone in your office, your AAA director or your contract and fiscal representative, and they can assist in getting that. And if you don't get there anywhere, then go ahead and contact myself or Lori Watt here in the office, and we'll make sure that you have a login, and I can help you navigate and move through RAIN so that you can see the information that's there. Then RAIN uploads at the end of the year. I actually aggregate all of the information, and then I upload it into our federal tool, which is called the SRT. It's a state reporting tool that's available to the states so that they can aggregate all of their NAPIS data into one area, which what we're looking at are these individual pages, and then I send it away to, we send it over to the federal government. Here is the NAPIS registration form. This form is available on the State Unit on Aging website. The link is right here. It might be small, but you'll find this at the very end of our webinar also. And this registration form is really critical because it's gathering the information what you need. So what you have first here is this section of tell us about you. This is not basically optional information. We do need to know their gender. At least that date of the year that they were born is going to give us that date of birth, so we know their age, the number of household, here's their street address and a mailing address. Here we need to know, are they below or above? So we can determine the number in the household. They're going to select which one of these is, or you ask them and you complete this, and this will determine if they are at poverty or not. Here we have the race right here, and here is our ethnicity. Now, beyond here, this section is actually optional information, and this is contact information. Then down here begins our nutritional data, in which we can determine indeed, whoops, I moved my mouse, determine if they are at nutritional risk or not. So we have those 10 questions. Then in terms of activities of daily living and instrumental activities of daily living, then if they would complete this or you can assist them, then you can also enter this data because it is reported again for any of our registered services, the nutrition program, not Congregate, but your home delivered program, as well as our personal care, homemaker service, chore, those registered services. And then also down below here in section 5 are the special needs, their special diet needs. So if we talk about where does this data go, I'm going to go through, and this shouldn't take long at all, but I'll go through a couple of screens. What I've done is a screenshot. If there's interest, I would be happy to actually do a webinar specifically on where you put your data, on creating a client record and navigating through Oregon Access. I can do that live so that you can actually see me go through each of the screens rather than look at a screenshot. And so again, my email's at the end of this webinar, and I encourage you to send me an email, let me know of your interest, and I can go ahead and we can pull one of those sessions together too. So what we're looking at now is, this is in the training module. I did not use the real Oregon Access. When you log into your Citrix account, or if you're in office where you're on a server and you don't have to rely upon Citrix, you will find that you will have a Oregon Access icon, and then there is a Oregon Access training icon. That training icon actually has a picture of a red schoolhouse. You can get into that training module anytime and fool around and not be concerned at all that you're messing up any information. Everything is all fake, and so it's certainly a safe area to explore Oregon Access. You don't want to do that in the actual production model of Oregon Access because every time you exit a screen, it saves. And so your data is in error is actually, I mean, it might be erroneous, but you're saving it. So please be sure to use the training module if you have any questions. So what we have here is the basic person detail screen. And so you want to have a person detail. You need to have that last name, your first name. Here is where it's going to decide what their gender is. You'll need to indicate on this particular person detail screen their gender. Here we again have their date of birth. You can put in the marital status. This is not reported in our federal report. That's not something that's asked for. So this example, I do not have it included there. And here is your race and ethnicity. Now the rural determination is actually, here's the icon. It's this person's face. And then you would need to go to the address tab. And it is, again, determined only by the zip code. So the address I would expect you would have in there, but if an individual will not provide you with a complete address, first I'm assuming they don't receive home-delivered meals. But if they're a congregate patron and they do not want to provide you with their address, at least get a zip code so that, again, your stats are up there with whether that individual is in a rural or not location. And this FIP county code is in there. However, if you don't have your FIPS county code, don't worry, you do not need to enter it. I found most people know what their FIPS county code is, actually, and it is available online. If you just do a search, you'll find that that information is there. So moving on to some other important screens that are actually providing us with these demographics, this is our smiley face icon. When you select that, it's going to open up all of these different tabs. And when you go to the OAA Summary tab, this is the location, and this is very important, and I noticed several AAAs, they have staff that neglect to go to this area, and I'll show you a little later how you know whether this tab has been visited or not. So this tab is really critical. This is going to default over from what you entered when you created the file. This you would always put in, and your NAPIS registration form should be reviewed annually because perhaps they weren't well, they didn't live alone last year, or they weren't below poverty last year, but circumstances have changed. This year they are, or their nutrition changes. I mean, all of those things. So it's really important to sit down annually and go ahead and complete that. And then come to this tab and go ahead and put your date in. Put in that whenever you want to review that, and you can set a tickler, and the system, Oregon Access, when you log in, if this individual is up to have their NAPIS registration updated, you will get a message indicating you can print a list of all the individuals that need to have their NAPIS reviewed. So here this is saying that this individual was actually, their data was reviewed in October. They've set it, and they're going to get an announcement this year, 2014, reminding them. At this time, the individual was single person in one household here, and their income level was below poverty, and they've indicated that. They actually, in another screen, not this one, but they've gone ahead and actually indicated the actual income. That is not necessary. Sometimes you'll find that in the system because the client might be a Medicaid client or receiving OHP or SNAP, and in that case, the APD offices are required to actually detail their total income. And so that's why that might be here on this screen, is because it is available in another, so the system will pull it over. Now by the way, it does have their race and ethnicity, and these are drop down, so you can go ahead and populate it here. However, it will auto-populate if you have already entered it in this screen here, which is the very first screen. All right, so let's move ahead now, and we're going to take a look at our 2013 home delivered meal data. So this year, what we have is home delivered meals. We have We've provided 12,636. Well, we've provided 1,623,742 meals to 12,636 individuals. 6,092 of those were actually at nutrition risk. Now, when we look at that full breakdown, oops, pardon me, I've got something else in here. I'm going to talk briefly about nutrition risk. This is actually the Oregon Access screen in which you will enter in, and again, this is under the smiley face. Now, we had just a few slides back, we looked at the OAA summary tab. Now we're going to look at the nutrition risk, ADL, IADLs. And so this right here, this screen is showing the nutrition risk. And so you would go through, and as you answer these, yes, no, yes, no, yes, no, this will slide up and indicate whether the individual is at nutrition risk or not. Just, you can see here that just answering 4 questions with a yes, they've elevated above high. They're up here. You can imagine the more yeses, the higher this red is going to go. Now, next we're going to look at ADLs and IADLs, the client demographics, and so your activities of daily living are eating, dressing, bathing, toileting, transferring in and out of a bed or a chair, and walking. The instrumental activities of a daily living are your meal preparation, shopping, medication management, managing your dollars, housework, light or heavy, and transportation. So when we're in this same module, the smiley face module, on this tab of nutrition risk, IADLs, we just looked at the nutrition risk tab. Now when you select your ADL, IADL tab, you come down here and you can select ADLs, and it will show you all the ADLs, and you move them over appropriately according to that client and whether they are assistance needed, or if they're totally dependent on it, or there's another choice which is unknown. Then you would also select the IADLs and again move those over. And so what you can see here is a compilation of both the ADLs and the IDALs for this client, and this is a real client, and that's why I've actually whited this out just for confidentiality here. And this is over at our AAA Columbia Action Team. Julianne Davis is attending from that AAA here today. I see her name. Hi, Julianne. All right, so here's an example of this client's ADLs and IADLs. So here when we look at our 2013 numbers, we know, in fact, this client here is among here. I pulled one of their home-delivered meal clients. So that's, and in order to blow this up so you can really see it, and again, the whole page isn't presented because we have the details of our ethnicity are actually detailed below, and I don't have that here. But I've shaded your ages so you can see those easier, and it's fascinating information. So look at this. Of the 12,636, and this is really good, you guys, of that total number of recipients for home delivered meals, we actually only have the age missing for 107. I mean, you got to know, is that individual 60 or over? I mean, it's a home-delivered meal. You've gone out to their home. You have done an assessment. You're doing one every 6 or 12 months on the individual. So let's get that age in there because obviously you probably have it. It just isn't in the system. So as you cruise through here, look at this. This is fascinating. I like to go clear over to the 85 and over. So of that total number, 12,529, 3,186 of those individuals receiving the home-delivered meal are actually 85 and over and have a dependency of 3 or more of those IADLs. Again, you can go down. Here is our gender, female and male. Look at the rural. Of that amount, 12,529, because we know that's how many, we know what their age is. Again, when you come over here, a whopping 881 of those individuals are living in a rural area. And then cruise right down here, you'll see that 1,889 of them actually live alone. 385 have an income below the poverty level. So as you can see, the depth of these demographics are really important to reflect what's happening in your agency as well as for us statewide, this aggregate report. It really tells a lot, and you can really assemble some excellent tools for marketing your programs and aiding everyone to understand what you're doing and encourage them to assist in funding these programs. Okay, so let's move on. That actually was the instrumental activities of daily living. And remember these numbers. I mean, just don't remember them, but remember those compared to our activities of daily living. So here we have that same number, 12,529 of those. Now you'll see over here that, in fact, let's take a good look again at the total age, 85 and over. So when we're looking there, we have 852 individuals who actually need assistance with 3 or more activities of daily living out of that 12,529. Again, we have a substantial number that are female as compared to male. 240 reside in a rural area. Their income poverty level, we have 143 are actually below poverty level, at or below, and then 407 of those individuals actually live alone. So again, you know, I'm just giving you an example of the data and how detailed it is, and if we can get the information into the system, you can look at these reports and come up with some astounding tools to aid you in your work. So here, this is back to our Section 1A page, or actually this is our Section 2A page of the SPR, and I wanted to show you other nutrition services that are reported. Here we have nutrition counseling, and you'll see that in 2013, 1,355 clients received counseling. 467 of those were gauged as nutritional risk, and the total number of units was 1,532. So it appears that several AAAs have actually provided more than one session, or I'm saying several because it's assumed. I doubt that only one of you are doing this, but you can see that more than one client has received a session. More than one session has been, hey, this would be so much easier if I'd say it this way, more than one session has been received by a client. And that's why we have this higher number. It isn't a one-for-one. Also, we have nutrition education down here. And on nutrition education, the federal government does not ask us to does not require us or ask us or have any room in their report for us to actually report the number of clients who receive nutrition education. That's something that they, at this point, are not ready to ask us. We gather it. It just doesn't upload into this cell. However, they do want to know the number of units that were provided during that 12-month period. And so you'll see here that in Oregon, 20,412 units of nutrition education were provided from July 2012 to June 30th, 2013. Now, we talked a little bit about special diets. That's on the registration form, and I wanted to show you the Oregon Access. Oh my goodness, I apologize. This might actually be a person. Before I post this on the web, I need to wipe this out. You're all bound by confidentiality. Oh boy. Okay, so here we have a screenshot of Oregon Access, And I neglected to show you this, the little smiley face. This indeed is the same smiley face icon. You'll recognize these tabs. We looked at the OAA summary tab earlier. We have looked at nutritional risk. We looked at the nutrition risk tab. We looked at the ADL, IADLs, and here is the special diet tab. And I want to show you that, and unfortunately you can't see this, but if I didn't have this monthly transaction paste right here, you could see that as you select, you would add, and then those are listed over here. And then what I wanted to show you, why I have this pasted in here too, is this data. When you select this diet data, this is the transaction report for a home delivered meal, route for Northwest Senior and Disability Services. This is from their Newburgh site, and you will find here and I'm going to go down here to this one. Well, let me tell you, Charles and Clarence, they do not have any particular nutritional needs. There's no code. But when you look down here, you'll see that Liarta, Evelyn, and perhaps that's Iantha, have special needs. And it is actually, this isn't a special needs, that's her address. This yellow is by error. I'm sorry. I'm glad I can give you a good laugh, though. So let's look at Liarta and Iantha here. You'll see that there is an asterisk after, so it comes the address, and then would have their special needs. So there is an A and there is an N. Here we have an N and a K. Now, I don't have the decoder, but at the end of this monthly transaction record, it actually will print a page in which it will tell what that A represents, what the N represents, what the K represents, and any other of these special diet needs all have their own symbol, and that way that will actually make sure that the individual delivering the home delivered meal, if you're utilizing this monthly report or monthly record, they would be able to see that this is the meal. They need to have a low sodium meal or a diabetic meal, and so they would look and make sure that that's actually what they are delivering. Okay, so I want to talk to you a bit about helpful reports also. These are reports that many of you will indeed be familiar with, and if you're not, I do have instructions on how to do these, and that is available on the state unit website. And I can also run through and do a one-on-one with you anytime. Just give me a call and we can schedule, and I can go ahead and demonstrate how to use these reports. And I can also do a webinar again when we do a webinar on navigating Oregon Access, and we'll be sure to go through this because the reports are extremely valuable too in helping you. You do not have to rely upon the data that uploads into RAIN to at a glance see what's happening at your area agency on aging. So let's go right in, and I'm going to show you that you can obtain a nutritional risk report. Now, where you're going to log into Oregon Access, I'm returning here to this screen, so you have logged in. It defaults to that particular, to your district. I actually, for purposes of this, I have Rogue Valley Council of Governments up when I was online and captured this screenshot. You want to come down and select Reports. When you do that, it's going to give you a whole list of reports, and you need to scroll down, and you can see by the distance here between this light area and my darker shade here that I am about halfway down, and that's where we find the OAA client list. Now on this, and I didn't do the drop down here, but this drop down would be, you can actually do approved, denied, closed, any of those. So you go ahead and experiment and you can see different things. But what's really critical here for you in determining the number of individuals at a nutritional risk is to use the approved. You can actually put in your age range, 60 to 70, 70 to 80, whatever you want, and then go ahead and select your nutritional risk. You're going to complete here the service date range. Down here are our filters. Now, the less filters you use, the more data, district data, you will actually return. I will show you in my next screen I believe I didn't do very many filters at all because I wanted a good return. But if you wanted to see data specifically for a site. So how many those individuals at nutritional risk from 19 to 21, and you don't have to populate the age if you want. It will instruct you what needs to be populated or not because it will not pull a report. It'll say you need to select an age, but something like that. But if you wanted to determine a specific nutrition risk, put in your dates. If you want it for a site, select that site. You do need to select a service. So we're talking Congregate or are we talking home delivered meals? So you would choose your service. A qualifier is that the standard is at the rate of duplicating myself, is the standard qualifier. Other than standard defaults, that's our default qualifier. Other than that, you can actually select OAA. I mean, there's a whole bunch of them. OPI, Medicaid, frozen meal, shelf meal. Oh, I mean, it's a whole bunch. So a qualifier is that method of actually filtering even more. So if you only wanted to see your OPI clients who have a nutritional risk, you would actually select that OPI qualifier. If you only wanted to see those individuals who receive a home-delivered meal that is frozen, if you use that qualifier in your office, then you'd be able to select it here, and again, you can pull a report. Now, a qualifier, this report's only good on those qualifiers that you use. So what I typically do actually is I want to say, don't give me a specific qualifier, give me every one that's in the system that the AAA is using, so I select all qualifiers. Then again, if you want to have just provider specific, you would also select the provider. Arrange by site name, that means if I am not specifying a site, I can and I don't want them just all together in alphabetical order by name, I can actually say arrange by site, and it will identify each site and then the client under that. So now, by the way, if we were doing this, I would actually not push print first. I don't know how long the report is, what it looks like or anything, so preview first, and that way you can look at it. So on our next screen here is the preview. So here's what I selected. I selected the age range of 75 to 100 in years of age. I wanted to see the 19 through 21 for this last fiscal year. I did the whole district wide. I didn't specify anything else except home delivered meals and all qualifiers. And you'll see here that it returned a list of individuals. So this client list, and this is just partial because I didn't want to show you everything. I just want to demonstrate to you what is showing here. And so this actually is a list. I've whited out names, but you can see the name of the individual, their address, their residence, their telephone number, their date of birth, and what their language that they speak. What we have earlier, remember we went to the OAA summary screen. And I was indicating to you that if that screen has never been visited, that you can find out how that is. The reason is see these client IDs? This actually is the indication that that screen has been visited for this client. So Ronald, the worker at RVCOG, has gone into that screen and they have identified information in there. For example, they probably put in the last time they updated the NAPIS, and they indicated whether they were below or above income, and they also input the number of the household. So that's what, if you pull a report and there is no client ID on a client, then that's an indication that you have missing demographic information, because that particular tab, the OAA summary tab in the smiley face icon, has not been visited. Okay, so another report that's available is the billing summary. Now, of these two reports, there's a service and billing report and the billing summary. And I apologize that we actually are using terms that really are not relevant to OAA clients, because obviously that is not a means-tested program. The only requirement is that this be offered for a contribution only, and there is no billing. However, the developers of the system did not understand that, and they used this term billing summary. So I want to clarify for you that don't be misled by that billing. And what this really, a billing summary that we're going to look at is really showing us it's a service summary. Now this service and billing summary here, which I will show you one of those also, this top report is actually going to return the service and the client name as well as the number of units they received. This billing summary is going to only return the service and the units. And in this example, you will see, again, we talk about the filters. So you can, again, filter through. The more filters, the more critical digging down into a specific area you're looking at, the less filters, the more information it will return. Now, I did specify a service, but if I had not, and I went ahead and ran this report just based on the district and all qualifiers and then pushed review, it's going to return every single service and the number of units for each of those services that your AAA has provided. In this instance, it's only going to return the home delivered meal information. Here's an example. So here's an example of Northwest Senior Disability Services. It's for this last fiscal year. You will see that it is, again, only for home delivered meals. And I said all qualifiers. I did not say specifically that I wanted to only see standard. So here you're going to see the value of a qualifier also, because that qualifier will distinguish the variables between what you are providing. So in terms of a home delivered meal, you can see that Northwest Senior Disability Services during this last fiscal year, they have actually served 107,297 meals. Of those meals, the actual units, that's the ACT, is actual units, 1,954 were frozen regular meals. You'll see they use the qualifier low salt meals, frozen low salt meals. So here's the number of those that were provided. 5,682 meals were provided to OPI clients. An additional 1,618 frozen meals were provided to OPI clients. Now, I'll just mention here, if you're expending OPI dollars on home delivered meals, then you do need to be able to tell the state the number of meals and the number of clients. So you can't just batch those in as a standard meal. We have to be able to report to the legislators the number of clients served and what they received. So in this terms, it would be this number of home delivered meals. So this is the value of a qualifier. This further shows you how you can even distinguish those OPI home delivered meals. You can distinguish the number of frozen from the number of hot. Here they have served 6,772 Title 19 meals. And standard, remember, is the default. And so in this, in terms of looking here, I would read this as Older American Act. These are actually OAA meals, because we see how many OPI meals, how many meals were paid with OAA dollars. This is how many were paid with OPI dollars. This is how many were paid by Medicaid. And this, I would also assume these up here were also paid with OAA dollars. So in terms of inputting your data, if you're not using qualifiers, it will default to standard. And when I am looking at your data and I see standard, that is Older Americans Act, because you have two particular streams of funding from the state of Oregon in terms of your nutrition program, and that is your Older Americans Act funding and your OPI. And so OPI needs to be distinguished. Everything else would be Older American Act, so you can either use the OAA qualifier or you can use the default standard. Okay, let me check my time here. Okay, we're at 2:44, and we need to get cruising right along so that we can complete this. We do need to finish up by 3 o'clock, and I want to show you here, this is also the billing summary report. So again, what you'll see, whoopsie, is here is an example. Baker is really good about also identifying their volunteers. So you'll see here are volunteer congregate meals. Here's their standard, which would be their OAA. And here are other volunteer meals. Since it's not noted as a congregate, my assumption is that this may be their home-delivered meal driver volunteers. I'm not sure, or just other volunteers. But they have definitely wanted to distinguish between their congregate volunteers and their regular volunteers, so they have utilized this particular qualifier. Okay, we talked about, again, this is the billing summary. Next, moving on, is that one that's called the service and billing report. It's the top choice there. And what you'll see here is this is returned, as I said, the client name, what they received. And you'll see here, I didn't do all services. I, again, said only congregate. So I have outlined and said congregate meals for this period. This is the district. And so, again, it's saying, okay, Clifford received 85 frozen regular meals. Charlotte received 18 standard meals. And Blake is a volunteer under 60, and he received 1 meal. So again, just the value of reports and pulling. And so, just to reflect back on what we've been talking about, the data that you report substantiates the value of your program. And additionally, you get that bonus of you're tracking your service trends. So we're coming to the conclusion of our webinar. I wanted to tell you, this is just a clip of a screenshot of part of the Area Agency on Aging business page. Here is the link, and here is some reporting guidance. So under this reporting guidance, you will find some information on data collection. Here is the most up-to-date NAPIS registration form, which we just looked at. This was updated, I believe it was February. It was updated, and it's updated every February, actually. It was updated in February for the federal poverty guidelines. So each year, at a minimum each year, this form gets updated and is available here. There is also some information, Oregon Access Fundamentals, and these are not webinars. Oh wait, this one is a webinar. This is a webinar that I pulled together for adding services providers, qualifiers, and OAA sites. The other ones are actually PowerPoint, and unfortunately there is no voice, but I will be, as I can, replacing those with actual webinars so that you have the sound of instruction and go through. But you can also see here's other aids, how to batch, how to print a service unit report and print a service recipient, which we just looked at. So here again is your reminders on how to do that. Okay. So I'm going to unmute you, and I want to offer you that opportunity to go ahead and ask questions if you have any. I really want to say thank you so much for joining me today. I really appreciate that.
Rhonda?
Yes, Marvin.
Yes. What's the usual length of time if a nutrition center doesn't get their NAPIS forms filled out? Like how long does that affect funding to the nutrition center, or what's the general policy?
That's a really good question. In terms of funding, it is only going to affect funding if your AAA has actually in your contract made some type of a statement that you will withhold funds. The information that we upload to the state program, to the federal government annually, that is looked at annually by OMB, and they appropriate the dollars. But typically we do not see any difference in the numbers and our funding for a couple of years. So it's not an immediately, the fact that we are not having the data in there is not immediately affecting, but it does affect in the long run. And this year in particular, there will be a huge emphasis on missing data. And the federal government has included in the state reporting tool a particular report in which we will identify the number of missing demographics. And so as I upload your report in, then I'll be able to print that and provide it to you. And then you would be able to go back and recognize how much of, well, actually you'd recognize which of the data is missing. And I can work on AAAs with them, too, on identifying that right now. Just by looking at your particular page, you will see if it's missing. And the only problem is we can't pinpoint it to a specific client. So you'd really have to have your staff go in and check each of the client records to see if the data is there.
So, but what you're saying is, can somebody go for as a guest in an unlimited amount of time?
We really advocate that a guest is only allowed to be a guest 3 times.
So after that time, it's necessary to get the proper data.
It is. It's really a reflection on your area agency because it's going to appear as missing information. So the more guests you have, or the more guest entries, then the increase you're going to have a higher percentage of missing data.
But what if they refuse to fill out the NAPIS report?
I'm sorry. Could you repeat?
The question is what if they refuse to fill out the NAPIS form?
Well, we talked a little bit about that earlier, and indeed, they may refuse to fill it out, and we cannot require it. We don't want to withhold anything if they don't, but I would encourage you as an individual to sit down again, and we need to explain why we are providing the information. See what they will. This may sound odd, but the federal government has actually advocated that if they will not provide you with the date of birth, use a menial date of birth then. Take your best guess, and you're going to put it as January 1st, and your guess of that last year, their birth year, and put that in there. I'm not comfortable actually trying to figure out someone's ethnicity and race. However, again, we are encouraged to do that. Most of us are aware, well, I hate to say this, I live in a small community, and yes, we're aware of people's poverty, so I could easily just go ahead and put whether they're below or above poverty too. My point is just do what you can do.
The simplest information, for people not to fill out the forms, they're not explaining that there's a connection between their ability to get a meal and the information. It's just, to start with, it's just name, a possible birth date, simple information to fill out the form so that they're no longer a guest. And I think it's important for nutrition centers to understand that.
I agree with you, yes.
Well, you can get names and gender and fill out the form. If they refuse, again, after 3 or 4 visits, there's things that you can do. You have to get the data. I have one other question. If a nutrition site is billing for home-delivered meals, is that against the statutes of the OAA?
It is, absolutely.
Okay, so that's an infringement on a contract then?
Yes. Now, you can ask for a contribution, and I've seen many of the AAAs will utilize this system. In fact, Oregon Access has a billing component for OPI, so they enter in the number of meals that were provided. They input what their average cost per meal is, and so they send that letter out and say you received, a value of this, and if you'd like to contribute, please do. Lack of contribution does not disqualify you from more meals, something like that. But no, we are not to ask for any kind of reimbursement unless the individual is under 60.
Thank you, Rhonda.
You're welcome. All right. Are there any other questions?
Hi, Rhonda. This is Sandy.
I'm assuming we can get this webinar.
Oh, let's see. Marvin, would you mind muting? I think we get an echo from you. Okay, go ahead, Sandy.
Oh, am
Big
I there?
Yeah.
Okay. I was wondering two things. Who in the state of Oregon is doing nutrition counseling? I was unaware. I know we're all making an effort to do nutrition education, but I'm real curious about who's doing the nutrition counseling. And if you don't know that off the top of your head, if you could send that information, that would be really useful.
Okay. I do not know on the top of my head, but I would have. Oops, I muted myself. I'd have to go through each individual SPR to determine that, but I'd be happy to do that.
I think it would be curious. I think the people that gather regularly aren't aware of anybody.
Okay. You bet. I'll get it for you.
I have one other question.
Go ahead.
The report section of Oregon Access, you can get I wasn't aware of the nutrition risk report, but I'm wondering if you can pull a report there. It doesn't look like you can pull a report for consolidated nutrition risk data for your area. Like, I would like to be able to, without going through and doing a whole bunch of math and myself, to say these are the number of high risk and low risk and medium risk people. Just a simple report like that.
It is available district-wide, or you can zoom in and actually use filters and do specific by site.
But without, I mean, I don't want it on the individual level. I want it on the program level. Is it possible to have just a consolidated?
Oh,
we
I'm
have
sorry.
X number of high-risk clients getting Meals on Wheels in our area.
Not without adding that up. It is not, but that's an
Okay.
excellent point, and I'm going to make a note of that, because as we look to create a new system, because the state is moving to Oracle, that's something that I need to be sure to note that we want to be able to do.
Right.
All right. As well
Thank
as
you.
we also, one of the things we want to do is be able to pull a report of individual names and what they're missing in terms of the information that's in the system.
Right.
All right. Well, thanks, Sandy.
Thank you.
Does anyone else have any questions? Well,
Hi, Rhonda. I do.
all right. Go ahead. We've got 3
Hi,
minutes.
my name's Corey. I'm from... Oh, sorry.
No, go ahead,
My
Corey.
name's Corey. I'm from the Rogue Valley Council of Government. Do you guys look at the narration part in OA?
Well, not regularly, but I mean, it's available, and if I'm looking at a particular client, I will look at that to determine what's happening.
Okay.
That was an easy one. No, nothing in narration reports to the federal government. All right. Well, I want to
Okay,
say...
great. Thanks.
Okay. All right, Corey. So thank you, everyone. I really have enjoyed being with you today, and I really appreciate your input. Interactive webinars are absolutely the very best. And as I said, this will go up on our SUA website. And when it's posted, if you are already signed up as getting an update on every time something's posted to that site, you will be notified. I want you to have an awesome afternoon and a wonderful rest of the week. Feel free to contact either Kim or I. You're welcome, Evelyn.